My name's Rae O'Leary, and I'm going to be sharing a bit about public health concerns and opportunities for sovereign tribal nations. I am the Assistant Director for Missouri Breaks, which is located on the Cheyenne River Sioux Tribe in South Dakota, and I'm a member of the Turtle Mountain Band of Chippewa, which is in northern North Dakota. My background is actually in respiratory therapy, was my first career, and then I expanded into a degree in nursing and then a master's degree in public health. And a lot of my work revolves around not only advocating for public health in the tribal community where I'm located, as well as surrounding regions, but research to support public health, essentially. So that's kind of a high-level overview of what you'll hear from me. First, I want to start off with orienting with who I am and where I come from. You can see, again, Turtle Mountain in North Dakota. I also spent a good part of my life in eastern South Dakota and Montana. And currently home is Cheyenne River, where you can see the beautiful picture from our family's ranch. You can see myself and my family with my 97-year-old grandmother. That's a photo from this summer, and I always like to include her and acknowledge her in my work because she's somebody who had a strong desire to become a nurse and help her community and didn't have the opportunity. So a lot of what I do and my motivation comes from her. So to start kind of with the public health issues linked to tribal laws, it's important to understand that Indigenous people as a whole throughout the entire world have dealt with disease, genocide, and erasure. And that often is the systemic result of settler colonial policies. And of course, there's a long history, and we don't have time to get into all of that today, but it's just kind of a foundational understanding that needs to exist before we can really think about how to combat some of these things in tribal communities. Tribal nations in the United States have inherent sovereignty, which basically means that Indigenous people were the first people of North America, essentially. And before colonization had sovereignty. There was no one there saying how to live, what laws to follow. They governed themselves. And that's something that has been upheld in treaty obligations with the federal government and continues to be acknowledged that at least federal tribal nations have sovereignty to self-govern. So there's a lot of nuance, but basically sometimes we have to look at who has jurisdiction in certain areas, and that could be the federal government, that could be the state. But as long as we're talking about sovereign tribal nations, the ability to govern lies within the tribe itself. And that's why there's an opportunity to self-govern in the area of public health laws and policies as well. I also want to note that there are over 200 state-recognized tribes that are actively working to gain federal recognition. There's a lot of benefits, of course, to federal recognition because of the treaties that are in place. One example of a benefit is the Public Law 638, which basically says that there should be set aside funds and rights to healthcare and access to ownership of that. And that's something that can't exist unless there is federal recognition. So it's not only the federally recognized tribes, but the states that we need to think about as well that are actively petitioning for that federal recognition. The tribal public health emergency codes have occurred at a lower rate, unfortunately, than other government authorities, and that's something that tribal communities are actively working to address. One review done by the National Congress of American Indians in 2014 found 520 public health related codes, and they kind of categorize them into different areas, which include agriculture and food safety, alcohol, tobacco, and other drug policies, animal management and control. That's something that many tribes have to deal with on their own, and it is a public health concern. Emergency planning and management, that became very evident in the COVID pandemic. Of course, the most relevant to this is the environmental health and health data, health services like emergency care and clinical care, specialty referrals for medical care, things like that. Infectious disease management, again, COVID is very relevant there. Injury and violence prevention, things like traffic codes and things to prevent injury. Public health infrastructure, and then the health and cultural resource protections. So those are kind of the categories that NCAI uses to group all the potential public health policies and codes that exist for sovereign tribal nations. So if we look at some examples of public health policies, and these are ones that I have some experience or exposure to in my line of work. If we think about chronic disease prevention, there's been some huge wins, especially for Navajo Nation in the area of junk food tax. And that's something that they've been a leader in, and there's a lot of information online if that's something you're interested in looking at. But basically, it's implementing a policy to incentivize healthy food choices and take away an incentive to purchase unhealthy junk foods. Other chronic disease prevention policies is no smoking policies in public places. That's something that I have probably the most experience in when it comes to public health or tribal public health policies, and I'll get into a bit more on that in the next slides. And then breastfeeding is an area that I'm really passionate about with my maternal child health background. That's considered, a public health opportunity to prevent chronic disease, because we know that protections to support breastfeeding in the workplace or pumping or just adequate time and a safe space to do that encourages women to breastfeed longer. And of course, then that's going to reduce rates of things like obesity and chronic disease later on in life, both for the mother and the child. And then infectious diseases, this could include things like STDs, or the obvious recently is COVID-19 precautions, and we'll get a bit more into that as well. Injury and violence prevention, traffic violations, there's a reason that we need to tell people to drive slower in school zones, because that's been a public health issue in the past, and that's what sovereign tribal nations can do, is say this is not, it's not safe to drive, 30 in a school zone. Animal safety, domestic violence, child abuse, and elder abuse, those are all injury violence prevention areas that tribes can govern on. And then again, with environmental protections, some examples that I've worked in is burn bans during droughts. That's important because if the environment can't support safe burning practices, then that needs to be regulated, because if people are burning, that could be a public health crisis as well. And then proper disposal of trash and illegal dumping. Those are things that need to be regulated and monitored. So we are doing everything we can to protect Mother Earth. Water quality standards. Of course, there are federal water quality standards, there's state water quality standards, but that's something that tribes do have the authority to say, we believe that the federal and state water quality standards are not adequate. So we're going to make our own more stringent water quality standards to ensure that our population has access to safe drinking water. And then here, I just wanted to share some background on a bit of the smoke-free air policy advocacy that I've done on the Cheyenne River Sioux Tribe, which is what CRST stands for. I've led the Chunli Coalition of CRST since 2009, and our initial aim was to enact a policy that makes the reservation smoke-free in all indoor places. And the reason that was needed, of course, is because tribal sovereignty. At that time, and back in 2009, 2010, the state of South Dakota was negotiating, and there was actually a vote that went out to to pass a smoke-free air policy for all of South Dakota, but because of tribal sovereignty, the 9 tribes in South Dakota were not protected by that state policy, so it was on us to do our own. And this is kind of just showing a timeline. The big policy that we were seeking to pass took us 6 years to get passed, because in a community with very high smoking rates, it's not a popular thing to regulate. But that doesn't mean it's not the right thing to do, and that as public health professionals and a nurse that cares about the health of my community, that it doesn't need done, right? So for 6 years, we advocated for this policy. You can see that there was a lot of small policies that we had kind of worked up to the big one of making the entire reservation smoke-free. And those were things like smoke-free parks, more stringent policies with tobacco use on school grounds, our powwow and our rodeo grounds. These are all areas that we were able to get some level of protection against the dangers of secondhand smoke. And of course, it was a lot of momentum building too that led up to that big policy being passed in May 2015. And I just want to note that, of course, the work's not done when the policy is passed. There's a lot of follow-up and enforcement and protection of the policy that needs to happen to make sure that communities are getting the maximum benefit of policies that do exist. So this here is a framework that the Chunli Coalition put together, because at this time, I believe there's only 5 or 6 federal, tribal, or federally recognized tribes that have comprehensive smoke-free policies. And because it's kind of rare, there's a lot of other tribal communities that said, hey, we want to work towards that. What's the recipe? What worked? How can we do the same in our own tribal community? So I know there's a big movement right now across the nation of some incredible work that's going on related to the prevention of and cessation, I guess, of commercial tobacco use, but also the promotion of traditional tobacco in tribal communities. So this here framework is kind of a structure, I guess, that we put together to support other tribes in their pursuit to address commercial tobacco use and exposure, as well as promoting the cultural use of traditional tobacco. And you can see that there's 2 circles, and that is education and policy, and then an overlapping circle in the middle that is community engagement. And the reason for that is because education around tobacco or any public health policy or topic can't happen without an engaged community. And similarly, the policy can't happen without an engaged community. So there's an entire toolkit that I'll post a link to, and that's something that there's all kinds of resources for. This framework was built for tobacco prevention and cessation, but it's a framework that can be cross-cutting to COVID or breastfeeding policies or any tribal public health policy, really. But the idea is that we continue working. You can see that the arrows show a never-ending flow of work to be done, both in education and policy and community engagement. And the thing that connects all of these is, and makes them more successful, really, is incorporating cultural lifeways along the way. So we're not just using, a CDC approach in tribal communities. Not that there's anything wrong with CDC approaches or any other best practices for public health, but it's important to make it local and feel like something that the local community can connect to and that resonates with them. And that's why we do our best to embed cultural lifeways throughout the framework. So I just wanted to touch quickly, because COVID is so relevant right now, and tribes really had a big role to play because of the sovereignty. Again, the state and federal policies weren't necessarily applicable to federally recognized tribes. So a lot of the response to the COVID-19 pandemic fell directly on the tribes. And this showed kind of a lack of infrastructure to support a nationwide, worldwide pandemic. This is something nobody saw coming, but it's something that we can learn from our past experiences and hopefully make changes to make better position ourselves as sovereign tribal nations to respond to these emergencies in the future. So if we think about all the areas that the tribe had to address when the COVID-19 pandemic came, we're looking at adequate testing, reporting procedures. Again, then it gets tricky with reporting because there's federal tracking, there's state tracking, and there's tribal tracking, and not always do those reporting systems communicate. So that's just something to be thinking about. Mandatory isolation and quarantine for people that do have COVID, mask mandates, contact tracing. Again, there are federal and state systems for contact tracing, but if your local nurses and public health professionals are involved in that, it's going to be a lot more effective in a small, tight-knit tribal community. Vaccine availability and promotion. Border patrol is something that Cheyenne River Sioux Tribe, as well as several other tribes, included in their response to the COVID pandemic. Healthcare, do we have adequate staff and equipment to respond to this? In-home prevention and treatment. So are we getting information out so people can do their part to prevent the spread and treat themselves if they get COVID or have access to treatment? Education systems. Of course, we know that the schools were really heavily impacted by the COVID pandemic, and that's something that the tribe had a role in supporting those schools to make sure that they were using safe practices and following guidance to reduce spread in the schools. Supply chain issues, of course, was a worldwide issue. Physical activity, can we still safely exercise, and what does that look like? What safeguards are there to support mental wellness during this pandemic that had a big impact on mental health? Cultural supports, are there certain cultural practices that aren't safe to do during COVID, or are there modifications we can make to the cultural practices to help them be more safe and less risky for COVID spread? Funerals, lockdowns, curfews. There's so many areas that tribes responded to the COVID pandemic. Some did better than others. Some had, better systems in place and infrastructure to respond in a quick way, and some really struggled. And what we know about the COVID response across tribes is that regardless of how progressive they were, there were a lot of risk factors in place that contributed to very high rates of spread of COVID, as well as higher rates of mortality and death from COVID, unfortunately. So these are, just a high level of various public health concerns for tribal nations, as well as opportunities for sovereign tribal nations to address public health. I also wanted to touch on just one slide of a different presentation on equity and reciprocity when it comes to partnerships with tribal communities. And this is not only public health based, but research based as well, because again, we have to have data and research to support these policies, to know what's going to work, what is needed even in tribal communities. So I'm going to talk quickly through this concept that is a work in progress for Missouri Breaks, that kind of shares a lot of what we've done in practice for many years at Missouri Breaks. As an organization, we've been doing research since the 80s and 90s and have been in this community and for decades at this point, and have worked very hard to establish trust with our community. And that's really been beneficial for our ability to do recruitment and do research in a good way with our membership. So you can see here that on the left-hand side, there's tribal community roles, and on the right-hand side would be external researcher roles. And kind of the overall flow of what we've always done and will continue to do at Missouri Breaks is starting with that research concept and study design. And then moving into, the data collection and management piece. And then after we have all the data, then comes the results and the dissemination and getting those results into the proper hands so change can be made. And then finally, sustainable outcomes. So the research is not just kind of a flash in the pan. Here's what we know today about it, but how can this research be, or the information from the research be leveraged to have long-term impact for the tribal communities that are partnering in the research.